Hi, my name is Brittany Hill, and today I'm going to take a few moments to talk to you about the 6 Thinking Hats method of parallel thinking, which is taught in the Nursing 320 course titled Introduction to Nursing Leadership at the University of Mount Olive RN to BSN program. This video presentation is an assignment for my Master's of Science in Nursing degree program at the University of Mount Olive. This short 5-minute lecture will be using the principles of the adult learning theorist Edward de Bono. The goal of this presentation is to provide you with a brief overview of the 6 Thinking Hats method of parallel thinking. The objectives of this presentation are to provide you with the understanding of the 6 Thinking Hats method of parallel thinking, the identification of the 6 thinking hats and their style of thinking, as well as how this thinking method can be applied in everyday practice. The 6 thinking hats method of parallel thinking was developed by Edward de Bono in 1985. The benefits of this method of thinking include improved communication and collaboration while creating an environment of understanding of different views and perspectives. This method of thinking allows the user to utilize 6 different perspectives when problem solving or making decisions. The 6 different perspectives of thinking are correlated with a different color hat. The white hat represents the objective form of thinking. This hat allows you to look at the data available to support you in the decision-making process. The red hat provides the user with the emotional insight and feelings. The black hat signifies risk. What are the consequences or potential barriers to this plan? What is the negative impact? Following the black hat is the yellow hat. This provides you with the optimistic viewpoint. Are there benefits of this decision? Next is the green hat. The green hat is recognized as creative thinking. What are the possibilities or alternatives? And lastly is the blue hat. The blue hat serves as the manager of the thinking process. This hat keeps everyone on track and supports the other hats in establishing an action plan. We have reviewed all thinking hats and their purposes in the decision-making process. Now it is time to apply it in an everyday practice. A great example of this would be the following scenario. You are the charge nurse on a very busy orthopedic unit. You are expected to flex staffing to meet patient care needs while adhering to the flex budget. When making the assignment for the next shift, you are trying to decide if you should keep an extra nurse. You decide to utilize the 6 Thinking Hats method to come up with the best decision for the team. You place the white hat on and to help you determine what facts you have and what are the expected nurse to patient ratios. What is the budgeted expectation for the number of nurses? Following the white hat is the red hat. You know it is best to keep a nurse as it will decrease the nurse to patient ratio to allow the nurses to spend more time with their patients, which will improve care given to patients. Following the red hat is the black hat. You must determine the potential risk. If you keep an extra nurse, you will be over budget and have to explain the variance to your manager. Now you must place the yellow hat to determine the potential benefits of keeping a nurse. If you keep an extra nurse, ratios will be lower, which will make your nurses happier. Following the yellow hat is the green hat. The green hat focuses on creativity. Is there a possibility just to keep a nurse for an extra 4 hours and then downsize? And lastly, following the green hat, you will need to place the blue hat. Now you have collected all of the information from the various perspectives and have to decide on a decision and an action plan. With all of the information, potential benefits and risks, feelings, creativity, and action plan, what is the best possible solution? This brief lecture provided you with an overview of the 6 Thinking Hats method on parallel thinking, identification of the 6 Thinking Hats and an example of how to apply within your practice. Thank you for taking the time and attention today. I hope that you will be able to use this method of thinking to solve difficult decisions you are faced with within your practice. Please complete the short survey provided through the Nursing Student Center and email it to my professor, Dr. Karen Rawls, at karen.rawls@umo.edu. Please do this within the next 3 business days. Again, I thank you for your time.